A warm welcome to all. We are just waiting for one of our chairpersons. Please bear with us for another 2 minutes, then we'll start the session. Thank you. Hello, everybody. A very warm welcome to all in LMHI 2021 colloquium. Today, we are really privileged to have a very august presence of our chairpersons. We have with us Dr. Dora. She is the National Vice President, LMHI Bulgaria. She is also the Education Coordinator for European Committee for Homeopathy. And presently, she has also presented various papers in various scientific conferences, and she's very well versed with the subject. The other chairperson with us is Dr. Virender Sharma. He is a renowned teacher, clinician, researcher, and an administrator with very vast experience. And he is the Deputy Director with Directorate of Ayush, Government of NCT of Delhi. He is spearheading various government projects and various research activities. We also have with us Dr. Subhash Kaushik, who is a scientist grade 4 with CCRH, which is one of the premier institutes for research in India. He is also the in charge of Dr. D.P. Rastogi Central Research Institute, Noida, one of the premier research institutes in Delhi. Welcome you all, sir and ma'am. Now, with your permission, can we start the session, ma'am?
Yes, it's a big honor for me to be here with you. Thank you for inviting me for this chair. And I'm very glad to announce the first participant for today, Dr. Samir Joshi from India, with his presentation about my experience in treating and managing COVID-19 cases.
Thank you, ma'am. Dr. Samir, please.
Good afternoon, everybody. I just share my screen. Yes, good afternoon, everybody. Today I'm going to present.
Dr. Samir, please zoom it further. Make it slightly bigger.
Yeah, I'm going to zoom it.
Yeah, thank you very much.
So I am going to present the COVID cases which I have treated, and I'm going to focus upon the efficacy of homeopathy in treating the COVID cases of different intensities. So for this, I have chosen 3 of my patients. The common factor regarding these 3 patients were all of them, they were of the age 55 and above and having some or the other comorbidities. So everybody were falling in the high risk categories so far as the COVID is concerned. Only thing is that they came to me at different stages of the progression of the disease, and still I was able to help them out with the homeopathic medicines. So to begin with the first case, the patient came to me with the fever and high grade fever and chills since 2 days. So he came in the initial phase of the infection. The symptoms with which he was presenting to me, I have already highlighted upon the screen. Now, when you go through all these symptoms, 3 remedies were coming very close to each other: the Pulsatilla, Gelsemium, and Arsenicum album. If you just go through the physical generals which were shown by the patients, the body ache and the heaviness of the extremities, heaviness and chills along the spine, heaviness of head with increased frequency of micturition, dullness, drowsiness with remarkable decrease in the thirst. These symptoms were more prominent as compared to the weakness, and that's why I chose Gelsemium, and I gave Gelsemium in 200 potency with frequent repetitions initially. When the patient came to me in the initial phase, the oxygen saturation was 94%, and that is the reason why I did the HRCT, but HRCT did not show any kind of lung involvement, fortunately. After starting Gelsemium, within 3 days, the saturation increased up to 98%, and then it remained constant throughout the phase of recovery. All the other symptoms subsided very nicely, and if you see the inflammatory markers, in the initial phase, only the CRP levels were raised. Rest all the inflammatory markers were well within the normal limit. And even the CRP came down within the normal limit in the second week itself. So even though the patient was in the high risk group, but still I was able to prevent the further complications or involvement of the lung in this particular case. And the recovery was uneventful because of the timely intervention of homeopathic medicines. The second patient, again, she came to me around 4 to 5 days after she started getting the fever. She has already taken the course of antibiotic before coming to me, but still when she came to me, there was remarkable weakness. As you can see, the local throat symptoms, the particulars were very characteristic and they were very conspicuous. But because of the weakness part, I focused mainly upon the weakness. When she came to me, there was tremendous tachycardia with low oxygen saturation, 93%. And as you can see, the HRCT, the CT severity score was 4/25. There was involvement of the lung. So initially I gave arsenicum album because I was focusing upon the weakness part, but it did not help. Then when I reconsidered the case, I found out that the weakness must be because of the prolonged infection, the temperature, then the low oxygen saturation, hypoxia. So I just took that weakness as a common symptom, and on basis of characteristic physical particulars, I administered Heparsulf first in 200 potency and then switch over to 1 m because there was some stagnation in between, with a remarkable recovery in oxygen saturation and rest of the complaints. Initially the inflammatory markers, the LDH and the CRP levels were raised, but then in the second and third week, both these inflammatory markers came within the normal limit with good recovery of the patient. Only thing is that this particular patient suffered from post-COVID effects, and there was persistent hypotension, hyponatremia, hypokalemia. And because of that, again, the weakness started increasing and the patient landed into a state of anxiety, panicky episode. She lost her confidence in moving about, and that is the reason why there was weight gain and hyperlipidemia. So these post-COVID long-term effects were tackled by the constitutional medicine lachesis. Third case, presented to me post-hospitalization. She was in very bad shape when she was hospitalized. As you can see that the lung involvement was too much. It was 2/3 of the lung was affected by COVID. The CT severity score was 16/25, and there was increased levels of interleukin, LDH as well as CRP. So she was in a state of COVID pneumonia plus cytokine storm. So initial state was tackled in the hospital, but after the discharge also she was in a state of hypoxia. The saturation was in the range of 88 to 89%, with lot of breathlessness, weakness, and the cough with expectoration. So here I applied the this three-legged stool prescription formula, concentrated upon the main symptoms which were presented by the patient. As you can see, the kind of expectoration, the modalities, and the sensation which was very, very prominent over here. And I prescribed Kali bichromicum 30 potency because there was gross involvement of the lung. And then there was a steady recovery in the patient's complaint. As you can see over here, the leukocyte count was high when she was discharged. Can you see on the screen? But later on, it came down to it started reducing with decrease in the CRP levels. So to summarize, in all the three cases, even though the pathologies were progressive or homeopathy has helped the patient in mild stage as well as in moderate stage post-COVID effects and certain post-COVID complications very effectively. The criteria on which I chose the remedy was the prominent symptom which I got from the patient either at the level of generalities or particulars or PQRS symptoms. Then I matched the pace of the disease or progression of the infection with that of the pace of the remedy which I prescribed, and the depth of the pathology which was presented in a particular case, and I matched with the pathophysiological action of a particular remedy which I was going to prescribe in that patient. Correlating all these factors, I chose the remedy, and after choosing the correct remedy, I got good results in various phases of COVID cases. Thanks a lot for giving me the opportunity to present my work on this platform. Thank you.
Thank you very much. We don't have time for questions, sadly, so I'm glad to announce the next speaker, Mr. Jagadish Sachidanandan. Sorry, Indian names are difficult for sometimes. A student at Sri Ramachandra Institute of Higher Education in India.
Yeah, hello. Am I audible?
Yes.
I'll be presenting my screen. Is my screen visible?
Yes.
Yeah. Yes. Okay. First of all, I'll start with my presentation. I'd like to thank LMHI for the opportunity and the esteemed panelists for their time. Today, I would be presenting a paper on a novel integrated multidisciplinary, multimodality, home isolation treatment during the peak second wave of COVID-19 in India. To give a brief background on the study, during the second wave of the COVID-19 pandemic, I was in my second year of MBBS medical training, and I wanted to provide any sort of assistance as I could. So hence, I ended up helping my mentors, who are senior allopathic doctors, who run a holistic center in collaboration with a homeopathic doctor. They had around 125 COVID-19 patients who were confirmed with RT-PCR and presented with a mild to moderate symptoms corresponding to the WHO ordinal scale of 1 to 2. They were given a full course of allopathic treatment as per ICMR guidelines, such as paracetamol or any NSAIDs or stuff, or they were given advice, general advice such as hygiene and steam inhalation. And some were also given a prophylactic arsenic album 30 as per CCRH guidelines during the second wave pandemic. After getting a verbal, written, and informed consent, the patients were given a potency-sized remdesivir 5 ml.
Please zoom in your presentation.
Is it visible?
Yes, that's it.
So, so they were given, the patients after getting a consent were given remdesivir 1C potency 5 ml twice daily for 10 days. By trying out this potency-sized remdesivir, we hope to achieve the prevention of progression of the COVID-19 to worsen prognosis such as WHO ordinal scale 3 and above. And with this would require hospitalization, which would increase the burden upon already burdenized hospital care at the time. And we also wanted to use this as a future tool in future waves of the pandemic. The methodology we involved this 60 ml mg remdesivir dissolved in 60 ml of sterile water. 1 ml of this mixture was further diluted in 100 ml of the sterile water. The mixture was shaken rigorously 10 times and left to stand for 6 hours. This gave us a potency of 1C. The dose, as I stated before, was 5 ml twice daily of orally potency-sized, twice daily orally of the potency-sized medication for 10 days. The results we obtained were of the total 125 patients under our care, those who had received this potentialized medication had a median recovery rate of around 15 days. And we were happy to see that none of the ones who received our potentialized form did not progress to a worsened prognosis. We would classify worse prognosis as anything above the WHO ordinal scale 3, which would require hospitalization. Their vital parameters were also checked regularly in regular intervals, and they showed no evidence of increase or progression. Also, another interesting fact, I guess, was in our study, we had a few patients with comorbidities such as diabetes, and some also had hypertension. And those patients, we were happy to say that did not progress beyond the ordinal scale 3. And this we felt was a pretty significant finding. I'd like to conclude my presentation by saying that potentialized remdesivir could be a very good management for COVID-19. However, the study we have conducted does not include many other factors. So we would like to go for the larger scale, the randomized double-blind controlled trial. So we could establish its usefulness in its role for the disease course, decreasing the disease course, getting early hospital discharge, and reducing the oxygen requirement. To give recent advances on the study, I managed to get an ethics committee approval, and this current study is currently been on hold due to time constraints by my mentor, but will be further expanded upon, and we hope to get a better outcome. Thank you for that.
Thank you. Thank you very much. It's a very interesting research you did. And I hope you will get all the necessary conditions to continue your study. Did you had the idea to try also with other potencies?
No, we did not, because since I mentioned before, my mentor is actually an allopathic practitioner, and he was more comfortable with the 1C potency, since that's what he had worked with, and he also had experience with the chemotherapy. So he had worked with 1C potency beforehand. So we stuck to a potency which we were more comfortable with at the time. Yes.
Thank you very much. I will be looking for further feedback from your work. Thank you.
Thank you. Thank you.
I also request Dr. Sharma sir and Dr. Subhash sir to please ask questions.
Mr. Jagdish.
Yes, sir.
Because you already mentioned that RCTs are the gold standard. Okay. And you have done this observational study. So it's nice to see. Congratulations for this work. And we will see further what you are doing with other potencies also.
Yes.
Potencies plus other medicines.
Yes.
Because you are not from homeopathic background. So it's a good study to start with. And being observational, we have a lot of limitations, like we have biased patient, we can select according to our comfort, all 125. In RCT, there are a lot of chances that we get the unbiased results. So all the best from my side. Thank you.
Thank you. Thank you, sir.
Hello, Dr. Jagdish. Being a allopathic, you can say, starter, you have tried homeopathic medicine through homeopathic mode of treatment. So it is a very nice presentation. Second, I want to know that you have put 60 mg of the medicines in 60 ml of water. So is there any particular guideline for this, or you have followed on yourself?
No, we use this for our convenience, because at the time remdesivir was given, according to the allopathic principle, remdesivir is dissolved in 100 ml of saline. 60 mg of remdesivir is dissolved in 100 ml of saline. But since we wanted to make this into according to the tautopathic principles, we wanted to make the calculation a bit more simpler for us. So we dissolved it in 60 ml of water, and we proceeded with the
I think if you will follow the pharmacopoeial guidelines, you must follow that this remdesivir is in the powder form, and we can prepare through a particular method of preparation, that is a pharmaceutical method. And if then we will follow, then we will call it as a true homeopathic potentization. So in future, please take the step and do like this.
All right.
Thank you.
Thank you, sir, for your valuable comments. With the permission of the chair, can we proceed further for the next speaker to? Our next, our next speaker is not available at the session right now. So we'll be going to the further next speaker, Dr. Satyashri Patnaik. He is from Orissa, India, and he'll be talking about the miracles of Merck salt in dealing with COVID-19 pandemic, the Hahnemannian approach based on observational study.
Great good afternoon to all the chairpersons, members and delegates of LMHI 2021. We are thankful for giving us an opportunity to present ourselves before the August gathering. Am I audible?
Please, yeah.
Yes.
The screen is visible right now?
So please zoom it further. Yeah, thank you.
The topic stands as the effectiveness of mercurius solubilis in dealing with the COVID-19 pandemic, the Hahnemannian approach based on observational study. COVID-19 has been a disastrous pandemic which has gripped the entire world with innumerable loss to human lives. The aftermath of the disease has been equally catastrophic, with patients developing vast array of symptoms ranging from physical ailments to psychiatric disturbances as well. Homeopathy offers a viable option in addressing it not only on the curative front but also on preventive and health promotive aspects. The methods that we adopted were as follows. First, the pathway of the virus was thoroughly studied along with its symptomatology at different phases of its progress, and then the pathogenesis was matched with the prevailing medicines from a homeopathic materia medica. The common symptoms such as anosmia, loss of taste, etc., along with the pathological findings were repertorized using the synthesis repertory 9.1 version. And with miasmatic considerations, we could finally find out the medicine Merck solubilis as a remedy for the prevailing pandemic. This medicine was utilized under both centesimal and 50 millisimal scale potency as per the requirement of the patient. Long COVID cases that were prolonged for more than 3 months were administered with usual 50 millisimal scale potency. As per Hahnemann's direction, the same medicine was also advised for the healthy individuals, especially the caregivers and the near and dear ones, the relatives of the patient, in the 30th potency, 2 consecutive doses for 2 days to be repeated in the same sequence for 4 weeks. The result part is very interesting that we observed. A total of 295 patients were taken for study, in which a positive faster response, which means the patients healed within 1 to 3 days, that is maximum 72 hours of time. The number stands at 241, which is more than 81%. A positive but a slowed response was observed in 8 to 10 days among 42 patients. The patients healed between 8 to 10 days. The number stands at 42, which means it is around 14%. And no improvement was observed in 12 patients. We somehow couldn't gather the prognosis, the diagnosis, or the cases were lost in due course of time. The number stands at 12, which is less than 5%. From this, all the patients were either tested with rapid antigen test or the reverse transcriptase polymer chain reaction and were symptomatically positive during the period of medication. 1,493 healthy individuals who were exposed and were asymptomatic and happened to be the near and dear ones of the affected individuals of the cases under study were advised to take this indicated medicine at suitable intervals and were reported to be safe without any symptoms or discomfort during this 9 months duration time, which corresponds to the second wave of COVID-19 in India. So from this study, we can conclude the following few things. The effectiveness of Merck salt could be established from the available data. As per the instructions laid down by Dr. Samuel Hahnemann in aphorism 241 of Organon of Medicine, 5th and 6th edition, we first found out the indicated medicine through observation of cases and then applied it to other healthy individuals. The most important observation that was found was that not a single patient who were cured from this medicine had any relapse during this 9 months study period. The indicated medicine not only restored health but also helped as a preventive among the exposed individuals and can therefore be considered as an effective genus epidemicus at the global level. The authors are indebted to Professor Dr. Somendu Adhikari sir, the former director in charge of the National Institute of Homeopathy, Kolkata, for being the first to propose the said medicine to the profession. Under his guidance, millions have healed during this pandemic. Thank you so much.
Thank
you,
you very
doctor.
much. I would request the colleagues from India to comment.
Dr. Patnaik,
Yes, sir.
you have mentioned that you have given this medicine, especially Merxol, in a suitable interval. What does that mean?
As per the requirement of the patient, sir, it was generally in the 30th potency for TDS we gave for 3 days, and the patient usually resolved within 72 hours. The number stands at 241. Few cases, those did not heal between the 3 days time, were repeated for 5 days. TDS.
As a prophylactic.
As a prophylactic, sir, we had mentioned over here, as a prophylactic, it was given 2 doses on 2 consecutive days, and that same fashion it was repeated for 4 weeks. So total 8 doses were given in a time period of 28 days.
So this type of research was registered under CTRI?
So we have applied for that, but we didn't get anything right now from here. Well, since the time was also very less, so we just first preferred to safeguard the health of the patients.
Okay. Thank you.
Thank you, sir.
I have a question. Did you increase the LM potency, or you have, and with which LM potency you started?
Yes, ma'am, sure. We started with LM1 potency. It was given TDS, and initially, as the patients progressed, it was decreased to OD once daily, and still the patients are continuing the medication. It is now continuing. Many patients are in 0/6, 0/7 potency, and the most important factor that we found was that even the glass ground opacity that was much prevalent among in the HRCT of lungs of the patients, that dissolved between maximum of 45 days of time. But the contemporary system of medicines, they say that it takes more than 3 months, 3 to 6 months sometime. But here we have all those data with us. So we have seen that the ground glass opacity.
I think the picture has frozen, at least for me.
Alternate days as well.
Thank you. So you, to be sure, you continued several months to give this 0/1, 2, 3, 4 potencies.
Yes, patients generally they have been totally well after the 0/4 potency. But as per Hanuman's instructions, aphorism 160, where Hanuman says that you keep on continuing the medicine till an aggravation comes, till an homeopathy aggravation comes. So we are just following the Hanuman's instructions, and still we are continuing.
Okay, thank you. Thank you very much. Very interesting presentation.
Thank you, ma'am. Thank you so much.
Any other questions, please? Dr. Kaushik, sir?
I think nothing from my side, but Dr. Patnaik, you said you started LM potency after 3 months.
No, sir. No, sir. Initially, the patients where the susceptibility was very less, where even we have seen oxygen saturation SpO2 to 84%. People are improving from there. When the saturation is very less, when the Corad's count comes at 4/25, when the D dimer is very high, C-reactive protein is very high. Even we have taken cases from the intensive care units, from many of the corporate hospitals throughout India. Many cases were taken from the ICCU also, intensive critical care units. There we prescribed 50 millismol potency from the day 1 itself. TDS, thrice daily. 0/1 was given thrice daily and was continued for 3 days, 5 days, and between very few hours, very less hours, we have seen patients tremendously improving.
And selection criteria for Merxol were only 2 symptoms: anosmia and loss of taste.
No, sir. We have taken. If you want, I can show you the repatriation chart as well. We had taken 23 symptoms for repatriation. Moxil was a leading remedy. And also from the Morpheus repertory, blood coagulates very easily. Only one medicine was given, that was Merck solubilis. We had a lot of study, a lot of review of literature, a lot of study from Organ of Medicine. Aphorism 194 footnote states that in a case where there are a lot of relapses, we have seen for the first wave, we see patients were relapsing even for the second time, third time. People are vaccinated, even are they getting affected for 3 times. So in all those cases where there is a constant relapse, Hahnemann clearly mentions 3 medicines from the general class of approved medicaments. He calls them antiphlogistic medicines: mercurius, aconite, brownia, belladonna, 3-4 medicines. And from here we could find out Merxol as a very suitable medicine. Also from the pages of chronic disease, there is a paragraph in the treatment of Sora where Hahnemann mentions in flu-like symptoms where things are relapsing, constant relapsing, he mentions 3 medicine: aconite, brownia, and Merxol. So from all this review of literature also, we could very confidently select Merck solubilis.
Thank you very much.
Thank you, ma'am. Thank you so much.
Ma'am, now further presentations are on the sub-theme case reports, cohort studies of thyroid and lifestyle disorders. We may first welcome Dr. Whiten Gosai. He will be presenting an observational study on complete reversal of autoimmune pathologies with homeopathy when practiced in a rational way.
Greetings to all the delegates. I, Dr. Whiten Gosai, have recently been working extensively on cases of autoimmune pathologies and got very good results in reversing autoimmune pathologies such as rheumatoid arthritis, Hashimoto's thyroiditis, psoriasis, and lichen planus. Autoimmune cases need to be approached with a certain methodology. I shall try and explain that approach very briefly here. Firstly, it is very important to understand what exactly autoimmunity is. Autoimmunity is the system of immune responses of an organism against its own healthy cells, tissues, and other body constituents. It is a result of an aberrant immune response. The immune system, which is supposed to protect us, turns against us. Instead of protecting, it starts harming us. We all know that any disease presents as mental and physical symptoms. Mental symptoms are given more importance than physical symptoms. Why is this so? It is because the mind is the commander and the body is the follower. The body is nothing but a mimicry of the mind. In order to treat autoimmune pathologies, we must first of all hunt for autoimmunity at the level of mind. If we can tackle autoimmunity at the level of the mind, then automatically the autoimmunity at the level of the body disappears. This is nothing but similia similibus curenter, similar and stronger. Now, what is hunting for autoimmunity at the level of mind? Any thought process that is directed against self. When the patient wants to harm himself, when the patient wants to die, when the patient wants to end his life, end his existence, anything against self or against life means autoimmunity. Most common examples of autoimmune rubrics are suicidal disposition and death desires. Others, such as reproaches himself. I cured a case of autoimmune diabetes with the rubric reproaches himself, trifles over, in which the medicine prescribed was Silesia. Other rubrics like anxiety of conscience, as if guilty of a crime. Then contemptuous of self. Treated a case of Hashimoto thyroiditis with lac caninum using this rubric as the entry point. And the anti-TPO came to normal within 10 months. Then delusion he is worthless, delusion he has murdered someone, delusion he is a failure, delusion he is a criminal, delusion that he cannot succeed and does everything wrong. This was the rubric that I took in a case of psoriasis and treated it with Baraita. So wherever the fingers start pointing to self rather than others, that is the rubric and that is the entry point for any autoimmune pathology. The case that I have presented here is a case of Hashimoto's thyroiditis. This patient presented with cough, which she had been suffering for the past 4 years, and it used to aggravate for every change of season. The neck of the patient seemed to be a little enlarged. I inquired about the enlargement and found out that she was a patient of hypothyroidism since childhood. I insisted her on getting her anti-TPO checked, which to my surprise, no physician had ever advised her to get. It was found to be raised. So we had a case of cough because of the pressure of the enlarged and fibrosed thyroid gland. Now I had to search for an autoimmune thought process in this case. This patient told me that in class 9th, she failed miserably in a mathematics exam. She had always been a very diligent student. And just after this, she developed hypothyroidism. The effect of the incident was that she could never teach her children mathematics. She used to get shivering before the child's mathematics exam. She developed a faulty perception that she is not worthy enough to teach a child mathematics. The rubric that I selected from synthesis repertory was mind dwells past disagreeable occurrences on, tormented by a frightful scene of some mournful event of the past. And the medicine prescribed here was Spongia tosta 200, 1 globule in 100 ml water, 1 spoon to be given OD, just as per the guidelines mentioned in the preface of the chronic diseases. And the original symptom is seen in Materia Medica Pura, symptom number 381, which states that she is timorous and particularly pursued and incessantly plagued by a frightful picture out of a melancholic past. The antibody titer came from 145 to 26 within 4 months. The girth of the neck reduced. Patient no longer suffers from cough. And what is most important is that now she can teach her children mathematics with much more confidence. That is the level of the effect of our homeopathic remedies. I have also had cases of rheumatoid arthritis in which the rubric taken was delusion neglected his duty, and the rheumatoid factor has come out to be negative, and also the anti-nuclear antibodies have come out to be negative. This treatment took 2 years. The entire distortions were reversed and the antibodies titers were also reversed. Thank you.
Thank you very much. Dear colleagues, do you have questions? Dr. Sharma?
Yes. I think he presented a very good case regarding the autoimmune disorders. And his approach is absolutely on the mental symptom related to the disease. And he took such a rare and you can say a specific symptom pertains to the patient, which also have a therapeutic range also. For example, if you will think regarding the hypothyroidism, spongia is again one of the best medicine. But if spongia correlates with the mentality of the patient, that includes, I think, 100% coverage. That is why he has got a very good result. And similarly, in case of rheumatoid arthritis, I think if such type of planning we adopt in other cases also, along with the mental plane, then we can achieve a very good result. Thank you.
Thank you, sir.
Thank you. My question is, what kind of potencies usually you use in autoimmune diseases when you see that there is a mental picture, such a strong mental symptom?
Ma'am, I generally resort to 200, 1M or 10M potency, and it is mostly given in the same way. 1 globule to be dissolved in 100 ml of water and to be given OD to the patient. The basis for this is whenever we are having a dynamic pathology, whenever we are having autoimmunity going on, then our potency also must be dynamic and we have to give it daily. I have also got results in 2 cases with a single dose of 10M potency, but this is the approach I generally follow.
So you give 200 every day for how long?
No, ma'am, it is basically a fractional dose of 200. I give it for a month and see the changes, and it is interspersed with placebo.
Okay, thank you.
Thank you.
Thank you. If no other questions, you can.
Thank you.
Any other questions, please? Dr. Kaushik, sir?
Due to unstable internet, I didn't get the full picture of Dr. Nitin Gosai, so I am okay. It's fine.
So, ma'am, can we move to the next panelist, please?
Yes, please.
Thank you.
Now we welcome Dr. Isbit Sturos. I hope I have pronounced it correctly. He is presenting an observational study on homeopathic approach of thyroid pathology, holistic understanding of subtle courses. You're welcome.
Thank you. Namaste. Good evening. Good morning. Good afternoon. Hello, everyone. Thank you for accepting my presentation for today. It is okay. My screen. It is visible.
Yeah. Please
it's
just
okay.
zoom it further so that it is more clear to us.
Yes.
Yeah.
So, so my topic is the homeopathic approach of thyroid pathology, and as my colleague presented earlier very beautifully, so I will not present the pathophysiological aspect of the thyroid pathology. As we all know, the prevalence of thyroid diseases are constantly increasing, and I wanted to show through my successfully treated cases that homeopathy offers a worthy alternative to consider in the treatment of these diseases, very effective if the remedy is correct and helps the patient to heal mentally, emotionally, and physically. From the psychospiritual point of view, thyroid pathology is related to the blockages of the fifth chakra, Vishuddha, which is about self-expression, creativity, relationship, the right to speak my truth, ability to trust, learning to express ourselves, to be heard and understood, to transmit and receive the truth. The holistic understanding of subtle causes help us homeopath during the case taking, knowing in which direction we should explore deeper the case, but it helps also the patient because through our case taking, usually they become aware about the deeper pattern of his or her life, attitudes, way of thinking, which need to be reframed in order to heal. In this way, we as homeopaths, we can help the patient not only by prescribing the right remedy, but also guiding her, him in this process of self-awareness and encourage them to make the changes needed in their lives. In all three cases which I present here, thanks to the process of self-awareness and prescribing the right remedy, the patient recovered successfully from their illnesses. So as I show here, you can see that theoretically we know that we have the blockage at the level of the fifth chakra. Our duty as homeopaths is that to explore how this blockage is happening in the patient life, and the patient will become aware that which attitude, way of thinking, emotion need to be changed. And of course, giving the right remedy, it is very important to encourage the patient in making these changes. And here I would like to present to you that in all my three cases, as I said, thanks to this process, the patient recovered successfully from their illnesses. The success of the treatment is reflected in the dynamics of the hormone values, but also in reaching a new quality of their lives and making the right changes. The first patient was a 56-year-old woman, suffered with Hashimoto thyroiditis and hypothyroidism. In her case, the blockages happened because she was dominated intensely for many years by her husband, so she gave up many wishes for the sake of the relationship. The main rubric in her case was ailments from domination for a long time, and the remedy was sepia. The second case was a case of diffuse goiter and thyrotoxicosis, a Bazadov disease with hyperthyroidism in a 40-year-old woman. In this case, the blockage was happening because she was in an inner conflict because of her job. She said that I feel like being in two boats. And also she has a desire to have a child, which was blocked for many years because she had no partner. And she also had heart failure. So In her case, the main rubrics was hyperthyroidism with cardiac pathology and 2 wheals. The rubric about having 2 wheals, and the remedy was lachesis. And the third case was a central thyroid insufficiency with thyroid nodules in a 42-year-old woman. In this case, she undertook many tasks at her workplace, knowing not how to say no at her workplace, and she also felt attacked by her mother-in-law. So in this case, the remedy was also sepia. And you can see here the dynamic of the hormone values. Beautifully, they became normal. And in all 3 cases, so in conclusion, the right remedy, along with the counseling, helped the patient to fully recover from their condition. Not only that the hormone values became normal, but they also became aware about which kind of changes they needed to do in their lives. Thank you very much.
Thank you, Dr. Touros. It's a real pleasure to see your presentation. It's always enjoyable to see that homeopathy can cure and recover health and also maintain health, because with explaining to your patients and with helping them to understand the deeper meaning, you are really doing prophylaxis. And I personally believe that this is extremely important to do with every patient, to talk to him and to explain.
Yes, especially if we would like to help them for a long period of time, not just for a hormone value.
Yes.
Thank you.
Thank you. Dear colleagues, any questions to Dr. Touros?
Dr. Touros, you have mentioned 3 medicines, sepia, laxis, then again sepia, but you have not mentioned the potencies, that which potency you have used.
Yeah, in the first case, I started with sepia 200, and after that I had given her sepia 1M rare doses. But the problem with this first patient was that she did not came regularly for the follow-up. So that's why in her case it took a longer time. But in a period of 1 year, you can see that the value was normal. In the second case, because here the value, just a little bit to show, it was a very bad case, as you can see here. The value was very high. That's why I started with LM potency 0 Y band. I had given her lachesis 0.1 by 1 daily, and in just months, the value became normal, as you can see here. And in the third case, I started with sepia 1M, and after just 1 single dose of 1M, the value became normal in a very short period of time, 2 months.
So here we can conclude, as in the previous case also, if we correlate our prescriptions with the mental base, that is by considering the mentality of the patient along with the diagnostic features, so we can achieve the target. Thank you.
Yeah, exactly.
Thank you very much.
Thank you.
Dr. Kaushik, sir, any questions, any comments, sir?
No, I'm fine. Great. This is a new approach. Let me go in detail and I'll comment. Thank you. Nice presentation.
Thank you very much.
Thank you.
I have even more cases, but I presented only 3.
Thank you.
Thank you.
So we can go to our next speaker, and I'll request Dr. Nazia to please introduce the next speaker.
The next will be Dr. Harshila Chandrakant Sarvagowd, and he's a assistant professor at Dr. M.L. Dhavle Memorial Institute. He'll be presenting on need to define the nature of stress to determine the posology in homeopathic management of subclinical hypothyroidism, an observational study. Dr. Harshila.
LMHI for the Dr. Harshila Chandrakant Sarvagowd, assistant professor in Dr. M.L. Dhavle Memorial Homeopathic Institute, Palghar, India. So today I'm presenting a topic, need to define the nature of stress to determine the posology in the homeopathic management of subclinical hypothyroidism. So as we know, today
Dr. Harshila,
among
just a minute.
all
Dr.
endocrinological disorders. Okay.
Dr. Harshila, your poster is not seen on the screen. Please share the screen. You have to click on that e-poster.
I have actually shared it. Just yes, I'm doing it. Is it visible, ma'am, now?
No,
It is
not yet
not
visible.
visible. Yes, it is
I don't know what
visible.
is.
Yes, it is visible now. Please go ahead.
Yes.
Zoom it a
Yes,
little bit.
I'll zoom it. Yes, yes. Okay. So the topic of my presentation is need to define the nature of stress to
Please zoom
determine
it a
the
little
posology
further.
in
Dr.
the.
Harshila.
Yes, yes, I'm doing. Yes, yes. Is it okay, ma'am?
No, no, you need to do it again. A little bit more. Yes, that's
Is
it.
this
That should go ahead.
okay?
Yes.
Okay, okay. So the topic the nature of stress to determine the posology in the homeopathic management of subclinical hypothyroidism. So among the most endocrinological disorders, secondary to the diabetes mellitus, hypothyroid disorders, that is the hypothyroidism, is more prevalent in a female population that we are seeing, and it is seen more prevalent in a female population. So, and the risk factor for the subclinical hypothyroidism, the exact pathology is not known, but family history and the stressful situation are commonly seen as the risk factor. So there are many studies which have done which actually suggests that there is a correlation between the stressor and the genesis of the thyroid disorders. So stressful situations actually disrupts the psychoneuroendocrine axis and leads to the psychosomatic illnesses like hypothyroidism. So in the homeopathic concept, we define those stress factors as a precipitating factors and maintaining factors and fundamental factors. So the precipitating factors, the psychological factors which give rise to the or give genesis to the disease, maintaining factors which maintains the disease, or the fundamental factors like fundamental psychological factors like the dispositional qualities or the attributes of an individual which will bring on the particular psychosomatic illness in the individual. So with this understanding, we try to understand how an individual will react to this particular stressful situation and what will be the reactions, and with the help of that reaction we will be able to judge the susceptibility, and that will be the one of the important parameter for us to understand the posology. So considering keeping that as a aim of this particular study, we started doing this study. Here we selected 30 cases through random sampling. Diagnosis of the subclinical hypothyroidism was done with the thyroid profile, where we did the serum TSH and free T3 and T4. It was a prospective case series study. A consent was taken of all the patients so that we will maintain the secrecy of the data and about the whatever the medicines we will be giving to them. Also the format we followed, that we took the detailed case history where we investigated the entire life journey of the patient, and we tried to identify the stressful situations and its impact on the individual. Then we tried to classify those stressful factors as a precipitating factor, maintaining factor, and fundamental factor. And the follow-ups were studied. The cases had follow-ups from 1 year to 2 years, and the subsequent thyroid profiles consisting T3, T4, and TSH was done. So as you can see, the result that we got, that the anxiety and vexation, that is the suppressed anger or the long lasting anger, that was the one of the important stressful situation that we were able to find. The stressors as a maintaining factors and precipitating factors were the anxiety and its various shades, suppressed anger, vexation, dissatisfaction, the prolonged grief, indignation, fear of death. Those were the precipitating and maintaining factor. And the dispositional qualities or the attribute of an individual which acted as a stressors were the anxious personality, irritable personality, feeling of forsaken, strong attachment with the family, hypersensitivity, and image conscious. Also, we saw that in the many cases there was anxiety. So we tried to identify what were the various shades of anxiety that we could see. So we got that there was anxiety about self-health, anxiety about future, anxiety about children, anticipatory anxiety about work and performance, and anxiety about the image and what people will talk about them. So all those the shades of the anxiety that we were able to see. So now we will try to see after doing this study what results we were able to see. So first we will try to see when they were dispositional factor, as in the attributes or the dispositional qualities like forsaken feeling, image conscious, or hypersensitivity was acting. So in those cases, the reactions or the expression at the mind level was seen very characteristic. So we concluded in those patients the sensitivity at a mind level was very high. So in those cases, 1M potency in a frequent repetition was seen to be very useful in managing patient at symptomatic level and also at the biochemical level in reducing the TSH level. Similar way in cases where there was a moderate susceptibility, but at the mind level there was no many characteristic mental symptoms, and we concluded sensitivity to be moderate. In those cases, moderate potency in infrequent repetition was seen to be useful. Similar way, when we try to we try to analyze the effect of precipitating factor. So in precipitating factors, we got the anxiety of family and about children as most common precipitating factor. So these precipitating factors were able to increase in a TSH. So in those cases, we initially started higher potency, that is 1M potency and 0/1 potency in a frequent repetition. But later on, we were able to see the response of the situation very much improved.
Dr. Harshla, quickly conclude your session.
And the symptomatically, that is the subjective symptoms were also better. So yes. So in those cases, we were able to give, we were able to see that 1M potency in a infrequent repetition was helped. Similar way, when there was a stressful situation, giving rise to maintaining factors like anxiety and vexation for a prolonged period. In those cases, 200 potency in a frequent repetition was seen to be helpful. So here you can see this graph. We have started in all potency, but later on, as we studied the cases and the follow-ups, we had to increase the repetition. So the conclusion of this study is that when we study the stressor and its impact on the individual, it helps us to understand the susceptibility, and with the help of susceptible, or we can administer a homeopathic remedy in a correct dosology, so that effective and efficient management of subclinical hypothyroidism is achieved. Yes. So I'm concluding my poster. Thank you so much.
Thank you, Dr. Harshla. Do we have any questions for her? Sir, Dr. Sharma or Dr. Kaushik or Dr. Dora? Yes, sir.
Dr. Harshla, I was confused about this starting posology and helping posology. Can you define this again? Means you have started.
Yes, sure. Yes, sir. So, sir, as we started this study, so as per the assessment of the susceptibility, we saw that the moderate susceptibility. So we started with the 200 potency, but later on, as we studied about the maintaining factors and precipitating factors, we were able to see that in some of the individual, the pattern of reaction to this stressful situation was different. So on the basis of the assessment of sensitivity at the mind levels, how much reactivity at mind level they have got, on the basis of that we later on change the repetition or the potencies, like we in some cases we needed to step up the potency to 1m or 0/1 potency, or in some cases we needed to increase the repetition frequently.
Great, but that you have shown in the bar, na, so I was not able to understand the bar system in this.
Okay, sorry. Sure, sir. I can change the presentation. So,
Fine, okay.
yes.
What means frequent and infrequent?
So,
What means
ma'am,
frequent repetitions?
yes, ma'am. For this study, we made a standard criteria. What will be considered as a frequent and what will be considered as a infrequent. So, infrequent for this particular study, we considered one packet or a one dose in a week or a twice a week. Once in a week or once in a 15 days, and frequent repetition, that is a daily dose of the potency.
Daily dose of 200.
Yes, ma'am.
For how long?
Ma'am, this study was done for the almost for 6 months to 2 years. So some of the cases we study for 6 months, some of the cases we study for 2 years. So that's how some of the times in between the patients were all right. So that time we were not we kept patient on a placebo that time. But whenever, as I said, like the precipitating factors, so whenever there was a stressful situation and they were seen that TSH was on a higher side, that time we again had to come back and we had to give the minimum remedy in that particular potency and with the repetition.
So it means that you have given 200 every day for 1 or 2 months sometimes.
Yes, ma'am.
Okay, thank you.
Yes.
Thank you.
Thank you. Do we have any other questions? Or we can move ahead?
We can move.
Okay. Next presentation is by Dr. Nishita Bharat. She is an MD student at Dr. M.L. Dhavle Memorial Institute, and she will be presenting on the topic scope of thyroidinum 3x in the management of hypothyroidism, an experimental study. Dr. Nishita.
Hello everyone, am I audible?
Yes, you are audible.
Okay, I'll just share my screen. Is the screen visible for all?
Yes, it is visible.
Okay. Myself, Dr. Nishita Bharat Gala. I'm a student at Dhavle Institute in Palghar. My topic of research was scope of thyroidinum 3x in the management of hypothyroidism. We all know hypothyroidism is one of the most common clinical condition is seen, and it affects majority of the population nowadays. Levothyroxine is the only conventional treatment given for all the patients. It was commonly seen that even though the TFT levels were normalized in the cases of hypothyroidism, yet patients showed symptoms, or else the levothyroxine dosage was not sufficient enough to control the TFT. So, as we see in homeopathy, many approaches are used in treatment of such cases. Constitutional treatment or organ remedies specifically are used. So, my study mainly focused on the organ remedy. What is the role of the organ remedies in these cases? The remedy I used was thyroidinum 3x, as it was seen in the literature. It is made from the thyroid gland itself, and the study focuses on how thyroidinum helps and in what aspects it helps in the cases of hypothyroidism. So in my study, as we see, 24 cases were included in my study by simple random sampling, and thyroidinum 3x 2 tablets BD was prescribed to each one of them. TSH levels, and TSH levels were applied in the beginning of the study and also later on after a period of 3 months and again after a period of 6 months. Also, there is a clinical score called as a Zaleski score, which was applied before the study and subsequently after 3 months and 6 months. So Zaleski score is basically, it is a score of which consisting of a total of 12. It includes 7 of subjective symptoms and 5 of the objective symptoms of thyroid. According to this score, anything above 5 is 5 or above 5 is considered to be a hypothyroid case, and 0 to 2 is a euthyroid patient. Also, individual follow-up criteria, including subjective and objective symptoms, were made for each patient, and they were evaluated subsequently over a period of 3 and 6 months. What we found was in the study was that the mean thyroid levels seen before the study was found to be 26.34 units, and after the study, after the period of 3 months, the mean was dropped down to 3.42. Even the Zaleski score, the mean level was found to be before the study was found to be 3.7, which was reduced to 0.7 after the study. So also, if we on the level of symptomatic level, we saw that there was. So I divided the follow-up criteria evaluation into 2 groups. First, there was a partial improvement, which included the cases which were better by 50%. So those the improvement which was up till 50% were included in the partial improvement of the group, and those which were improved by more than 50% were included in the significant improvement group. So we see that according to this graph as seen, we see that there was most of the cases showed either partial improvement or significant improvement. Only a minimal of cases showed no change even after the treatment of 6 months. Also, we saw that out of the 24 cases, 15 cases showed reduction in their levothyroxine dosage, which is 62% of the cases were allowed to taper their levothyroxine dosage, which was again seen after a period of 3 and 6 months. All the cases could not be followed up to 6 months. Few were up to 3 months and the other were up till 6 months. We saw this that after this particular study that thyroidinum 3x was very effective at the level of TFT, at the level of biochemical levels, that is as we've seen in the TFT levels. In the subjective, at the subjective and the objective level as seen by the improvement in their symptomatology, and also it helped in reducing the levothyroxine dosage and majority of the cases as we saw. Thank you.
Thank you very much. Very interesting study. Promising, according to me.
Do we have any questions for her? Dr. Dora, Dr. Subash?
No.
Dr. Sharma?
Thank you. And keep doing. Continue.
Thank you, ma'am.
Thank you, Dr. Nishita. Now we will move on to our next presenter, Dr. Basima Muassam. She is again a PG scholar at Nehru Homeopathic Medical College and Hospital, and she will be presenting on the topic hypothyroidism in a 15-year-old female presenting with secondary amenorrhea and its effective management with individualized homeopathic treatment. Dr. Basima, over to you.
A very good afternoon to one and all. I, Dr. Basima Muassam, a third-year PG student from the Department of Metra Medica in Nehru Homeopathic Medical College, New Delhi, would like to thank first and foremost LMHI for giving me an opportunity for presenting, and my sincere thanks to my guide and our HOD, Dr. George Matthew, for giving me proper guidance and encouraging me to participate in this event. So now I'm sharing my screen. So I am presenting a case of mine. It is a case of hypothyroidism of a 15-year-old girl. See, she presented with the secondary amenorrhea, and she was already diagnosed a case of hypothyroidism of idiopathic origin. She has been under allopathic treatment for past 4 years when she reported to me. So along with the secondary amenorrhea, she was having other symptoms of hypothyroidism, like she was having puffy face and neck. Almost the neck was not visible because of the puffiness. And then constipation, then short stature. She was shorter than her normal average height, even though her both parents, mother and father, are taller. Then she was having shorter limb length also, comparing to the normal average limb length. Then she was poor in her studies also, like her school authorities were almost about to give her a transfer certificate in her 9th standard, because they are hopeless regarding this girl, whether she will get a pass in the 10th standard. So she was very poor in her studies, and also but she presented with the secondary amenorrhea. Since her menarche, she didn't get her menstrual cycles regular unless she is taking hormonal treatments with the overall tablets. So she was getting withdrawal bleeding every time when she is taking this hormonal pills. So after proper case taking and repatrization, graphitis 200 was the medicine selected, and a single dose was given to the patient in August, and in August 2012. So this was a case in my early years of practice. So after 2 weeks, the patient got her menstrual cycles, but it was very protracted. And after that, in the next month also, she got her periods at the right time, but this time it was not protracted. But in third month, it was delayed, almost delayed for another 10 days. So I repeated the graphitis 200 again, and she got her periods. So later on, her periods got regular, and she almost, her puffiness of the face and neck disappeared. She became a lean, reduced her weight. Then her studies got improved, and her constipation was relieved. And we have assessed the Swilowski's clinical score. Before treatment it was almost 8, and after treatment it was 2. And after 5 months, the TSH levels, when she started the treatment with me, it was around 100 micro IU per ml. And after a period of 5 months, we again repeated the thyroid function test. Then it was around 3.2, which is perfectly normal, within perfectly normal limit. It was 3.2 micro IU per ml. So this shows a perfect case of homeopathic management, effective management of hypothyroidism with individualized homeopathic treatment. So as I said, this was one of my case in my early years of practice. And so this case gave me immense confidence in treatment of endocrinological cases. So I thought of sharing this case with my doctor fraternity. So that's the end of my presentation. Once more, I would like to thank my moderators and organizers and audience of the panel.
Thank you, Dr. Basima. Do we have any question for her?
Yeah, Dr. Basima, you said that. Am I audible?
Yes, sir.
Okay, Dr.
Yes, sir.
Basima, you said that was the case in 2012. What about the follow-up of this case?
Yeah, follow-up, those about whom her school teachers were hopeless of completing her 9th standard. She successfully completed her 10th with flying colors, and now she is a postgraduate. And
she's doing well.
Yes, she's doing well, and she's perfectly normal also. She regularly comes to meet me.
Okay.
Once in a 6 months.
And you
with
said her
thyroid
TSH level gone down 3.2 from 100, na? Was it associated with any allopathic treatment at that time?
No, I have completely made her to stop the allopathic treatment. When she started the treatment with me, I tapered and stopped.
Okay, with the consultation of other allopathic physician or by your own?
By my arm.
Great guts. Okay, thank you. Nice presentation.
Congratulations.
Great.
Dr. Sharma, do you have any questions, sir?
It is a good case. I think we should follow the guidelines as per the protocols that I think she treated this case in 2012, and moreover the 9 years has been passed. and the results are good. And I think so at present also he's enjoying a good health. So thank you, Dr. Basima. This is a good case.
Thank you, sir.
Thank you, Dr. Basima. Next, we will move on to our next presenter, Dr. Saurabh Kumar Jain. He is a senior resident at Nehru Homeopathic Medical College and Hospital, and the topic of presentation will be evidence-based homeopathic management of gestational diabetes mellitus, a case report. Over to you, Dr. Saurabh.
I am going to discuss a case of gestational diabetes mellitus. And currently I am working as senior resident at Nehru Homeopathic Medical College. Is my screen visible?
Yes, your screen is visible. Your screen is not visible. You are visible. Please share your screen. Yes.
Okay.
Yes. Good to go.
Is it visible now?
Yes, yes. It's absolutely good.
Okay. Okay. So the topic is evidence-based homeopathic management of gestational diabetes mellitus, a case report. Actually, gestational diabetes mellitus is defined as glucose intolerance of various degrees that is first detected during pregnancy. It is apparent that even mild degrees of maternal hypoglycemia may result in fetal developmental effects. So here we are not only treating the mother, but also the offspring which is about to come. So this was an interesting case which I encountered when I was doing post-graduation. So the lady came to me for gestational diabetes mellitus. Her gynac told that your blood sugar levels are very high, and for this you should take any alternative method of treatment, because usually metformin is given in allopathic side, and this patient was suffering from a lot of weakness and vomitings. So she suggested that if you can find relief in some other pathy to just control your blood sugar, it will be very helpful for you as well as the offcoming offspring. So the usual signs and symptoms are very much the same for gestational diabetes and diabetes. So homeopathy, which is a common form of alternative medicine, which is used worldwide due to its minimal side effects, its remedies may serve as a potential treatment for the management of gestational diabetes mellitus. Here I would like to also quote an interesting research which was done by CCRH in 2008, which reported that alloxin 30x, 200x and 1000x potencies were found significantly effective in alloxin-induced diabetized rat models. Although homeopathic literature enlists many medicines for diabetes mellitus in general, still there is dearth of evidence-based published studies specifically for gestational diabetes mellitus. Okay, so the case summary is, the case of discussion is a 20-year-old female who is 3 months into her first pregnancy. And on consultation, as I had already told you, her main objective was to get her blood sugar under control, which at that time was 281 mg per deciliter. And that was a prime concern. Along with that, there were many symptoms which were marked, like anxiety, especially about the future, very much weak, fainting attacks and vomiting, which is a usual feature of pregnancy, but it was very much exaggerated in this patient. So on taking the totality of the case, this is the repertorization chart on repertorizing by radar software, synthesis repertory. These were the main symptoms which were taken. First one was mind anxiety, future about, then mind irresolution. She was very irresolute. Then physical exertion, as I've already told you, that weakness was very marked. That's why exertion, physical aggravation. Then she was an extremely chilly patient, heat, lack of vital. General's diabetes mellitus was also taken in the analysis. Then heaviness of head, and as I told you, vomiting was very marked in this patient. Okay, and vomiting and slight dull backache, which is also a common accompaniment of pregnancy. And interestingly, the most symptom coverage in this case was done by a small remedy, alloxin, because when I saw this medicine come at the top, although the intensity was less, but still it was covering the maximum number of symptoms. So I tried to refer some literature about alloxin, and interestingly, I found out that alloxin is a chemical which is used for almost all the studies for inducing diabetes in rats. In rat models, it is used to induce diabetes. So I thought that this could be a good learning for me if this medicine is helpful. As I have shown on the left side, alloxan is a chemical compound. To add to that, I would like to say that it is a uric acid derivative. Presently, everyone consumes fast food. This alloxan is also used for refining maida, or which we call wheat flour. Okay, refined flour. Refined flour. So many people are consuming this unknowingly, this product, and this chemical directly affects the islet cells, beta cells, okay, in your pancreas. So it damages them. So I thought it should be an effective remedy. And as I thought, when I gave this medicine on the basis of totality and on the basis of its specific action on the beta cells, so I found that the blood sugar levels normalized within just 2 months of treatment. The blood sugar fell from 281 to 108 mg per dl. And I also saw that during her whole pregnancy, she did not encounter any of these symptoms. And apart from that, after 6 months of treatment, she delivered a healthy, normal child, and she was free, and the child was completely healthy. There were no side effects. And so this is a very satisfying case because we were able to prevent any of the complications of gestational diabetes mellitus, as well as we were able to relieve. So homeopathy, which is always considered to be mild, and in cases of pregnancy, you always look for mild medicines which do not create any side effects. So homeopathic treatment has shown favorable and satisfying results in this case, and it demonstrates the scope of homeopathy in such cases, which needs to be backed by adequately designed research trials in the future. Thank you. That is the end of my presentation.
Thank you, doctor. Very interesting. And I think worth continuing to explore the action of this remedy with bigger groups of patients.
Do we have any other questions, sir?
Hello, Dr. Jain. You have mentioned that you have taken this in a potency. You mean to say, however, the CCH had advised in 30x, 200x, or 1000x. So, yes, how you proceed for the preparation of this potency, and what was the source?
Sir, source was I directly procured the medicine from Schwabe India Limited. This medicine was available.
So, have you tried later on with the except for the gestational in the normal diabetes mellitus?
Yes, sir. This was a very interesting insight. So further, I tried it just as a specific medicines in many cases of diabetes, and as a specific also, I found that it is very useful for controlling the blood sugar levels. Like we use Cifalandra and all as a specific. So this can also be considered as a specific medicine if we can design large research trials for the same.
So it was a conservative or as a curative?
Sir, what I feel, I watched the patient for the entire 6 months, and a healthy child was delivered. So I feel this was curative.
Okay, thank you.
Thank you, Dr. Saurav. Next, we have with us Dr. Swati Singh. She is MD scholar at Nehru Homeopathic Medical College, and she will be presenting on the topic obesity and its homeopathic management, a theoretic understanding.
Thank you.
Yes.
Yes. Thank you, everyone, and special thanks to LMHI.
Yes, please.
My topic is obesity and its homeopathic management, theoretic understanding. So obesity is one of the leading non-communicable disease condition which has impacted health all over
the voice is too much.
Sir, no, it is not from my background. It is
yes,
from
Dr. Harsha. Yes, it's fine now. It's fine.
Okay. So obesity is one of the leading non-communicable disease condition which has impacted health all over the globe. It is responsible for many morbidities and mortalities. So it is presenting as a major challenge to chronic disease prevention and health across the life course around the world. So attempt has been made to put few points in understanding the perspective of obesity and for providing excellent human health and welfare through homeopathy. So I'm starting with my presentation. Introduction. Overweight and obesity are defined as abnormal or excessive fat accumulation that present a risk to health. A body mass index over 25 is considered as overweight and over 30 is obese. Medical and psychological sequelae obesity contribute to major share of current healthcare expenditure and generate additional economic costs through loss of worker productivity, increased disability, and premature loss of life. So the aim was to find the role of homeopathic medicine in the management of obesity. So the methods for anthropometric measurements are non-invasive and help in assessing the nutritional status, identifying individuals at risk, monitoring the efficacy of nutritional intervention, and providing information about body store of fat and muscle. So few non-invasive methods are waist ratio, skin fold thickness, BMI, and waist circumference. So as per the discussion point, Dr. Hahnemann, as per Organon of Medicine, Dr. Hahnemann states in aphorism 4, he is likewise a preserver of health if he knows the thing that derange health and cause disease and how to remove them from present in health. So being obesity is one of the leading disorders, so it needs both general management as well as homeopathic management. So general management includes nutritional ketosis, calorie restriction strategies, detox diet, intermittent energy restriction, aerobic and strength exercises. Homeopathic management, as we all know, homeopathic prescribing is based upon individualization, which include proper case taking, knowledge of disease process, medicinal properties, doses, and preventive methods. It has been said that repertory, materia medica, organ of medicine are three pillars of homeopathy. So they all complement each other. So few rubrics for obesity from synthesis repertory, which can be useful for managing obesity, that are like in general chapter, general obesity, obesity accompanied by appetite diminished, obesity children in thyroid dysfunction from obesity menopause, obesity nutrition improper, obesity old people in. So these are the few rubric which can be useful in managing obesity. So the conclusion is many researchers conclude that obesity is one of the leading lifestyle problem and different strategies should be applied to resolve it. Obesity is considered as a constitutional defect or a defective illness, as said by Dr. Pierre Schmidt, and an organon of medicine from aphorism 172 to 183. So new medicines such as argentum nitricum, calcarea carb, carcinosin, and causticum have been found in various researches, which is useful in managing obesity. Thank you.
Thank you, Dr. Swati. Do we have any questions for her?
Thank you. I wanted to ask you if looking at that theoretical basement of obesity, you considered the connective tissue disorders. I mean, the weakness of the connective tissue, which is many times accompanying the obesity.
So, ma'am, you're asking whether the obesity is connected with connective tissue disorder or not. Yes, ma'am.
Yes, I'm asking if you have found such data, because according to my observations, there is such connection.
Yes, so ma'am, obesity, as it has been said, it is has a multifactorial etiology. So it has been found that it has a relation with connective tissue disorders. So we can if we are giving in a classical homeopathic way. So classical homeopathic takes in consideration of immunological aspect of a person as well as the medicinal history and family history. So it will help in finding the stress factor that has triggered the chronic inflammatory state. So if we are tailoring our therapeutic intervention to that individual patient, so it will help us to recover that chronic inflammatory state with its own immune system. So That's why homeopathy medicine can be helpful in such cases, because connective tissue is related to chronic inflammatory states.
Chronic inflammation, but also there is genetic defective situation.
Yes, ma'am.
Genetic defect, so it could be also compensate with homeopathic medication.
Yes, ma'am. Artisan has, okay, thank you, ma'am.
Hello, Swati.
Yes, sir.
I have one question that with this presentation, this poster presentation, what is the conclusion?
So the conclusion which I wanted to say that obesity is one of the leading factor, and it is being neglected, and the prevalence of obesity has been growing since 2015. That the data shows that the prevalence of general obesity has increased from 11 to 31%, and the central obesity has been changed from 11.9 to 36.3. So this obesity management is very difficult. Even allopathic physician, even alternative methods are being used to for help trying to manage the obesity. So my point is that in homeopathy, such trials should be done for controlling obesity as a factor. So this was I was trying to conclude through theoretic understanding. So more further studies can be taken up.
So I think your poster completely on the theoretical aspects. No any clinical exposure is there.
No, sir. No, not yet.
Okay, thank you.
Thank you, Dr. Swati. Now we will be moving to the last presentation of this session by Dr. Abdikam Chimthanwala. He is a senior consultant at Dr. Abdikam's organization, and he will be presenting on the topic homeopathic treatment for chronic hypercholesterolemia, high blood pressure, and extreme anxiety with regards to digestive complaints and observational study.
Yeah.
Over to you, Dr.
Yeah. Hello, am I audible? Hello.
Yes, you are audible.
Yeah. So
yes, you are audible, sir.
Yeah. So I am Dr. Abdikam Chimthanwala from the family of Chimthanawalas since the past 100 years. Let me thank first LMHI for accepting my presentation. Today I'll be depicting a chronic case and how does a homeopathy prescription and how does homeopathy is relevance in this today lifestyle disorders, including diabetes mellitus, hypertension, or hypothyroidism, because these are the cases which are flooded in our OPDs and we have to find an answer how to treat them. And now how homeopathy still stands strong in its principle in the 6th edition of Organon, and how the cardinal principles, if applied properly, today we get the results, mesmerizing and curative results in these lifestyle disorders. And what is the importance of Materia Medica, Repertory, and Organon, and if applied properly, how does this help us in our day-to-day practice in treating lifestyle disorders? Though I'll be depicting only one case, but with this case, I'll be trying to club a lot of remedies and a lot of symptoms what a patient suffers from in these lifestyle disorders. I'll first share my poster so that it is easy to understand. Can you see the poster?
Yes, sir.
So let me start with the relevance of this case is that in today's times, we're handling cases of grief, anxiety, and much more due to competition and rat race. And how this grief has affected our lives. Coping, how the stress factors, how it gives rise to cholesterol, diabetes mellitus, anxiety. Also note, the case, this was initially treated by conventional medicines. He had relieved the symptom until he took the medicine, but again back to square one when he stopped the medicines. So we have to treat a patient who has been deranged with a lot of medications. It happens in most of the cases that comes to us. And homeopathy has to attack the disease in multi-dimensional way. There are so many rubrics and sometimes are lost in the maze of rubrics. This patient had changed 26 physicians, as he confessed to me, and the chronicity of complaints required attention immediately with the psychological factors. The central theme of this case revolved around how the remedy fits the entire complaints that arises from lifestyle disorders, like high cholesterol or diabetes or digestive troubles or anxiety disorders. The beauty of homeopathy is the summary of the case, the core symptoms of the patient, that be it name of any disease, it follows the laws of homeopathy. The cholesterol, as you see on the chart, was 295 when the patient came to us, and it reduced to 185 in about 1 month's time. The diabetes controlled, and the fasting sugar, in fact, the post meal came to 123. The extreme anxiety for which the patient changes 26 doctors came down to absolutely curable limits. And in today's world, as we see, the same case I depicted, that grief, the consequence of grief, the very sensitive, least mental or least impression, the least word seems to hurt the patient so much that it brings down the complaints of the patient. All the allopathy medicines are stopped. Till date, the patient is taking treatment with me with no relapse, sugar under control, diabetes under control. So let us see a broader view now. This complaints of grief, this complaints of anxiety, most of the patients in our practice will come with the same complaints. For example, I gave this patient stephysagria, and let us see how stephysagria fits in today's day-to-day practice. As you have seen, stephysagria, it is written that he is worn out and exhausted. And the key symptom of stephysagria, complaints that come from pent-up warmth, suppressed anger, suppressed feeling, speechless from suppressed indignation. Such a beautiful line. Or you can say, he controls it and he suffers from it. When you control your anger, your suppression, a stephysagria patient goes into pieces. He trembles from head to foot. He loses his voice. He loses the ability to work. He cannot sleep, and the headache follows. All symptoms of suppression, a lot of cases we have where there is sleeplessness, there is headache, there is cholesterol, all related to this grief and anxiety disorders. And word to word, it follows what is written in stephysagria. In my practice, I have seen if 100 cases are there, 40% of cases basically are showing symptoms of stephysagria. The next medicine which I have used in my practice is lycopodium. Third, aurum metallicum, and then ignitia, ipecac follows with it. For this, it is very important to hear what the patient says in the testimonial. So you can go to the YouTube link and actually see how the patient tells the anxiety, the stress which is suffered from. That's why stephysagria, if you read from Allen's Encyclopedia, hearing guiding symptoms and Allen's keynote, word to word, it matches what the patient will say in front of you in today's world. Now, LM potency. I started LM potency because in 6th edition of Organon, if you see Organ of Medicine, the Volume 247, 248, he has written that LM potency I used to hasten the progress of cure by frequent repetitions of medicine and to avoid medicinal aggravation. This is the two things which I saw for LM. Of course, LM potency, if we try to discuss, it will be a lot of things to discuss, but these were the two symptoms which I saw in LM potency. And thirdly, during the action of one dose of medicine of centesimal scale, the second could not be repeated in spite of the presence of disease symptom in the organism. And every correctly chosen homeopathy medicine, even those whose action is long duration, may be repeated daily for months with ever increasing success. These are the important points. That's why I used LM potency. And to my surprise, with LM3 potency, till I reached LM3 potency, the patient was as good as cured. Now he comes to me for the past 6 months follow-up, sugar normal, cholesterol normal. He's still eating food high in cholesterol, good in sugar, but still the sugar is maintained and he's absolutely on placebo after LM3, and 6 months I have not repeated the medicines. So this one case, but it has a generalized effect on the whole economy, how stress, how suppression of stress, suppression of thoughts, suppression of anxiety leads to these type of disorders, and how a correctly chosen homeopathy medicine, according to the laws of Hahnemann, laid down by Hahnemann, will fit in this human race in treating these disorders, which are lifestyle disorders, because now the time has come that homeopaths should be able to treat and cure these lifestyle disorders in order to show that homeopathy works. The remedies, as I told you, stephysagria, lycopodium, aurum metallicum, ignitia, natrium mute, have given me tremendous results. And I follow 6th edition of Organon, where I use more LM potency so that repetition is good. And these cases respond well in LM potency. That's what I have seen in my practice. Thank you. before I sum up, please go and see the testimonial in the YouTube link given before, so that you can see exact wordings of the patient. How did homeopathy change his anxiety and his disorders, and how he's relieved with all the complaints he was suffering from. Thank you.
Thank you, doctor. This was the last presentation of our session. Our chairs have any questions they can ask?
Yes, I have a question regarding posology. How do you prescribe the LM potencies?
Yeah.
Continuously, or you do some interruptions, like 5 day you give, 2 day pause, and so on, and
Yeah.
at which intervals you increase the potency?
Yeah, so it's basically a very simple explanation I'll give you in shortest time. I start LM1 potency first, depending on the chronicity of complaints. If the patient says that he, like, if you see the testimonial, the patient has told that he has changed 26 doctors, 26 physicians, and he always finds a reason to go to the doctor because he feels he'll be sick anytime. In that case, I started Stephenson LM1 potency twice a day, so that I complete LM1 potency and see how does the patient reacts. He was better with LM1, then I went to LM2, LM2 potency once a day. He was better, the sugars were coming down, the anxiety was, once the anxiety starts coming down, then I start tapering. LM3 I gave once in 3 days. He was better after 3 doses of LM3, so I told him take once a week. By the time he was about 1.5 months old, LM3 was still left, but the anxiety was reduced so much that he told me on the phone that I don't need to come to you now because I feel very fresh. I can eat street food also without any complaints, and still my sugar okay. So still the patient has few ml of LM3 left with him, and he says that I'll keep this bottle and take it if there is an emergency. I've told him that. So depending on the symptom similarity, amelioration, I prescribe LM potencies.
Thank you.
Any other question we have?
Hello, Dr. Chintawala.
Yes, sir.
You belongs to very esteemed family. That's a very nice presentation. But
thank you, sir. Thank you so much.
But one thing I disagree with you, that you told me that 40% of the cases are covered by staphylococcus. If we find a uncommon peculiar symptoms in these 40%, you will find a 40 remedies.
Yes.
And no doubt that with the current stress, strains, or lifestyle disorders, most of the people having a mental journals, and if you will find a uncommon peculiar mental journal, we will find a definitely a remedy which is fit as per uncommon symptoms.
Yeah.
So thank you very much. You have a good lines for the mental journals.
Thank you so much. Thank you so much, sir.
Any other question, Dr. Kaushik?
No, I'm fine with this approach. Thank you.
Thank you, Dr. Abdikam.
Thank you.
So this was all in this session. Now I would like to ask our respected chairs to kindly conclude the session one by one by your remarks.
Thanks to all the participants. It was a valuable time being together. We got interesting ideas from the participants, and I hope they will continue their studies, and we will see much more research in future. Thank you.
So in this session, I want to conclude that most of the topics we covered with the thyroid disorders and related to the thyroid. And 2-3 speakers having different topics. But in most cases, what you have found that the mental journals yet having a super hand over the prescription.
Yes.
And if we'll go only by the therapeutics, that is only a guideline. And to fix the prescription, we must think regarding the mental journals as well as the physical journal, as per our Dr. Kent guidelines. So I am very thankful for the presentation.
Thank you, sir. Dr.
And salute to all the speakers. It was really a good experience indeed. And I congratulate all of you for your hard work. All the best. Thank you.
Thank you, sir.
Thank you.
We are grateful to all the honorable chairperson for sparing their valuable time and providing appropriate guidance to the participants. We also thank all the presenters for sharing valuable knowledge through these presentations. With best wishes And greetings from team LMHI. I am concluding this session. Have a nice day. Thank you.
Just one reminder, ma'am, please, to all our chairpersons to kindly grade those presentations, please.
Yes.
Thank you. Thanks a lot.
Thank you.